Good afternoon, everybody. How are you? We are so thrilled to have you here today. My name is Bill Hardy. I am President and CEO of Equitas Health, a role I've had for 27 plus years, and we just could not be more delighted to have you with us today. We're here especially to welcome and congratulate new HRC President Alphonso David, from whom you'll hear in just a moment. We are so thrilled to have him in this new and critical national role. We want to thank HRC for the incredibly important work that they do all the time, but you know we have an election coming up, right? So we want to thank them for their work. And I must say that we're thrilled that Equitas Health has achieved a perfect 100% Health Equality Index score for 4 years in a row. Recognized as an LGBTQ healthcare equality leader. Columbus community can be proud that out of 1,600 healthcare facilities evaluated by HRC, 9 facilities in Columbus have achieved HEI leadership status this year. 9 in Columbus alone. How terrific is that? Of course, what this really means is that we have better, more equitable care for the LGBTQ community here all across Columbus, and for those who drive sometimes hours to Columbus to get their services. In Equitas Health's earliest days, 35 years ago, AIDS was a death sentence. Hysteria and ignorance were rampant. We have some of that today. And there's virtually no LGBTQ inclusive care. And so the HIV and the LGBTQ communities and our movements have grown up together, haven't they? Today, thankfully, healthcare facilities here and across the nation are adopting policies and practices that are more LGBTQ welcome, inclusive, and competent for the patients for whom they care. Among the 9 HEI leader recipients today, Equitas Health is really a relative newcomer, first offering primary care in 2012. Our 2016 rebrand from AIDS Research Center Ohio to Equitas Health and our subsequent federally qualified healthcare status have opened our arms wider to care for more individuals. Equitas is from the Latin word meaning equality and equity, values that we all share. And our tagline is care for all. Equitas Health's mission is to be the gateway to good health for those at risk of or affected by HIV, for the LGBTQ community, and for those seeking a welcoming healthcare home. Like the other healthcare institutions being recognized today, we know that reducing health disparities requires having culturally competent healthcare providers who understand the unique, special, and unmet needs of the LGBTQ community. Equitas Health, like others in this room, is mission obsessed with these needs and these values. When Equitas Health opens our newest health center in Cincinnati later this year and our new pharmacy in Dallas, Texas in October, we will have 19 offices in 13 cities, serving tens of thousands of LGBTQ individuals, making us one of the largest providers of our type in the United States. In addition, our Prism magazine, which you can pick up here today, carries LGBTQ healthcare and lifestyle messaging, and our institute trains thousands of providers and companies to be more LGBTQ culturally competent. Equitas Health is proud to participate in the 2019 Health Equality Index report. We are dedicated to addressing LGBTQ health equality and grateful to be partners with HRC and others in this room today. Thank you for being here. We are excited about this day. This is a great day for Columbus. It's a great day for the organizations represented here. And it is now my pleasure to introduce Jay Brown, Senior Vice President for Human Rights Campaign Foundation. Thanks again for being here.
Thank you, Bill, so much, and Equitas Health for hosting us and for your leadership work on the HEI. I'm here as the Senior Vice President of the HRC Foundation, and at the HRC Foundation, we work to provide research, training, tools that are all aimed at moving entire systems to do better by LGBTQ people in our daily lives. Today, you'll get to hear how one of these tools is doing that work, the pioneering benchmarking tools that we have, the Healthcare Equality Index. The HEI began in 2007, so over a dozen years ago. We're approaching our teenage years. And our team has worked in those years with nearly 2,000 healthcare facilities to help them change the landscape for their LGBTQ patients, families, and workers. We provide expert consultation on everything from properly capturing patient data to implementing patients' bills of rights to ensuring equal visitation policies, and so much more. We have also provided training directly to healthcare staff. Since 2011, the HEI has provided at least 250,000 hours of LGBTQ inclusive staff training. Why do we do this work? Because we all know behind these numbers are real people. More than half of LGB patients have experienced some type of discrimination in healthcare settings. And that number rises to 70% of transgender and nonconforming folks. As a trans man and the dad of 2 wonderful kids, I know personally how crucial this work is. When we have emergencies, when we're in crisis, the last thing we should be worrying about is whether who we are or who we love is getting in the way of our health care. The HEI is working to create that change. I'm so proud to be part of this transformative work with this small but mighty team led by Hanuman, who you'll hear from this morning or this afternoon, and Marcos Garcia, who is also with us here today. Thank you both for your leadership on this tool. And also with us today is one of HRC's newest members, and I'm so excited to introduce him next, Alphonso David, the President of the Human Rights Campaign. Alphonso just joined our organization and brings with him an incredible and inspiring record of accomplishments. He's spent years working to advance civil rights, most recently in the New York Governor's Office, where he helped secure marriage equality in New York in 2011. He helped ban so-called conversion therapy, established non-discrimination protections for transgender New Yorkers, and expand Medicaid coverage for our community, to enact progressive policies to combat HIV and AIDS, and to expand access and reproductive health care, to require free translation services and essential state services, and so much more. We couldn't be more pleased to be launching the HEI today as part of the We Are HRC tour, marking the beginning of Alphonso's tenure as HRC's president. Please join me in welcoming HRC President Alphonso David.
Thank you. Good afternoon, everyone. Good afternoon. Jay, thank you for that warm introduction. And I especially would like to thank Jay and his entire team at the Human Rights Foundation for all of the work that they do, including making this report possible. I'd also like to acknowledge Equitas Health for your leadership, and thank you for hosting us today. And thank you all for joining us. I do not have to tell any of you here or any of you in this country that we are living through perilous times. The release of the Human Rights Campaign 2019 Healthcare Equality Index comes as the federal government is trying to strip away explicit healthcare protections for transgender and gender nonconforming people. This regulation is not only inconsistent with the law, but is going to block access to critical healthcare. As the Trump and the Pence administration continues to attack the fundamental rights of lesbian, gay, bisexual, transgender, and queer people, including rolling back protections under the Affordable Care Act and promoting a license to discriminate, it is critical that healthcare institutions stand with us. It is critical that healthcare institutions adopt inclusive policies. The Human Rights Campaign has and will continue to be committed to ensuring that we have inclusive policies and that we adopt best practices for the LGBTQ community, which is why this organization has fought for the past 12 years as you heard from Jay, for the past 12 years to make sure that hospitals and healthcare institutions have inclusive policies and that they adopt best practices. And this year, we have 680 hospitals and healthcare facilities that participated in the 12th annual Healthcare Equality Index. And this is a record, 680 hospitals and healthcare facilities. By participating, these institutions are making clear that they stand on the side of fairness and that they will adopt inclusive policies that will benefit all families, not just some of our families. These institutions are going above and beyond to protect patients and their families and to provide critical life-saving care for those who need it. Before I joined the Human Rights Campaign, as you heard, I served for many years in both the private sector and the public sector, working as a civil rights lawyer. I headed the New York Office of Civil Rights, where I expanded Medicaid coverage to cover transition-related care and expanded access to reproductive health. In the courtroom, I worked on precedent-setting civil rights cases across this country, affecting the lives of the LGBTQ community, as well as those living with HIV/AIDS. But it takes more than laws and litigation to achieve true equality. To achieve true equality, we need all of you. We need the hospital administrators, the nurse practitioners, the mental health professionals, and all other healthcare administrators across this country that will affirm that they care and that they care for every patient fairly, no matter their sexual orientation, gender identity, or gender expression. Adopting non-discrimination policies is critically important, and best practices as well in the area of patient care and support, employee policies and benefits, and patient and community engagement. By meeting these standards that are set by the Human Rights Campaign, these facilities are literally saving lives. We're literally saving lives when we adopt best practices. When individuals seek health care, they're often at their lowest point, debilitated, fearful, in pain. To face rejection, to face discrimination, to face bias, when you're also facing pain, just exacerbates your fear, it exacerbates the pain, it exacerbates the concern that you have, which is why we need healthcare professionals, healthcare facilities, and healthcare institutions that will adopt best practices, that will be inclusive, which is why this report is so critical. The Healthcare Equality Index is a model, and we're hoping that every healthcare institution and facility adopts it, because we need it. We need to make sure that when that transgender person is walking into a healthcare facility, they are being greeted with a smile. We need to make sure that the person with HIV who doesn't really understand how the medications is affecting his or her or their health understands when they walk in that door, they will see a face that's smiling. We need to make sure that the same-sex couple that is confronting some health challenges, when they walk into that doctor's office, are greeted with care and sensitivity. This Healthcare Equality Index will save lives, it has saved lives, and it's critically important that every healthcare institution adopts it. And it has been just my honor and my joy to take on this role to push the agenda that is all-inclusive for all of us, not only some of us. And I want to thank you all for hosting us again this morning, because healthcare is so important to people throughout this country. And unless you're sick or unless you have a healthcare need, many people don't fully appreciate how important it is to have inclusive policies. HRC is going to be on the front lines fighting to make sure that all of our healthcare institutions and facilities are inclusive. Thank you.
Thank you so much. I'm introducing all the speakers here this morning, and I'm very pleased to introduce the next speaker, who is the director of our Health and Aging program. She oversees not only the Healthcare Equality Index, but also our newest initiative in partnership with SAGE, which is the Long-Term Care Equality Index. Please help me welcome Director of Health and Aging, Carrie Hanuman.
Thank you, Jay. Good afternoon. I'm very pleased to be here with you all as we launch the HEI 2019. The HEI was developed to create a national standard for equal treatment of LGBTQ patients and their families and healthcare workers and employees, because as Jay mentioned, many LGBTQ people have faced discrimination in healthcare. So that is why the HEI exists. It exists to help healthcare facilities that want to eliminate disparities and discrimination, and it provides a roadmap of policies and practices that help protect LGBTQ patients and their families from discrimination and make them feel welcomed and included. As Jay mentioned, we started in 2007, and a lot has changed in the 12 years since we started the HEI. We've made tremendous progress towards LGBTQ equality over the past decade, including in LGBTQ healthcare. But as Alphonso noted, this progress is under attack by a president and administration that is doing everything in their power to roll back LGBTQ rights. Fortunately, organizations and institutions that serve the community, like those that are here today, have stepped up to advance equality and ensure dignity for LGBTQ people in their daily lives. The Healthcare Equality Index and its sister indices, the municipal, corporate, and state equality indexes, are not just metrics, but tools to enact real change. They are guiding states, municipalities, workplaces, and healthcare institutions to adopt LGBTQ-friendly policies and practices, sometimes in spite of and ahead of politics or the current law. So these indices and programs are more important now than ever before. Because of them, regardless of what happens in Washington, D.C., good people in hospitals and workplaces and schools across the country will continue to step forward and do what is right. And here in Columbus, or the Columbus area, there are a lot of good people doing this work. The Columbus area had 10 of the 31 healthcare facilities from Ohio that participated in the HEI 2019. Every healthcare facility that takes the HEI survey is on a journey to provide the best possible care for their LGBTQ patients, and they should all be commended for their work in taking this journey with us. However, we do also like to recognize those healthcare facilities that are raising the bar and have enough LGBTQ policies and practices in place to receive a top score of 100 and earn the designation of leader in LGBT healthcare equality. This year, 406, or 60% of our 680 participants earned this designation. However, here in the Columbus area, 10 out of 10, it's 100 for anybody that's math challenged, 100%, of participating facilities earned that designation. So I'd really like to commend these 10 facilities for their leadership. Thank you all for doing this work. In addition to that 100% rate, one of the reasons that I was very excited to select Columbus as the location for this year's launch was because those 10 facilities really represent the diversity of healthcare facilities that participate in the HEI. The HEI was started initially with a focus on hospitals. However, in the 12 years we've been around, we've really broadened that, and we have a variety of different types of hospitals and different types of healthcare facilities that participate. So Ohio Health had 4 participating hospitals. They are one of over 120 different healthcare systems that have hospitals that participate in the HEI. This was their first year of HEI participation, and all of their participating hospitals hit it out of the park and earned leader status. The healthcare system that has the largest number of healthcare participating facilities is the Veterans Health Administration. Very important given the number of LGBT and veterans. And I am pleased to note that for the 6th year, the VA Chalmers P. Wiley Ambulatory Care Center is once again a leader. The Ohio State University Wexner Medical Center and the James Cancer Center represent the large academic medical centers and specialty hospitals that participate in the HEI. Nationwide Children's Hospital is one of 30 pediatric hospitals participating this year and has a model clinic for gender-expansive and transgender children and youth, which I think you'll hear a little bit more about in a minute. The Columbus Department of Public Health is one of only a handful of health departments that participate in the HEI. And finally, our host, Equitas Health, represent the community health centers that participate in the HEI. I congratulate and thank all of you for your hard work on the HEI. And speaking of hard work, I would be remiss if I did not extend a special thank you to my Associate Director, Marcos Garcia, for his efforts over the past couple weeks in finalizing the HEI and coordinating this event while I was on a long planned vacation that ended up being very poorly timed, but I had a great time. So it's a pleasure to come back to this event and see all of you. The work that Marcos and I do, and our program coordinator Sam, with hospitals and healthcare facilities like the ones we are honoring here today, help ensure that the community has access to LGBT inclusive care. We are very proud of this work, and there's so much yet to be done to ensure that all of us are free to live our lives without fear of discrimination. And now I'll turn it back over to Jay.
Thank you, Tari. Our next speaker, they're going to demonstrate the importance of inclusive care because we need to take a moment to get Melissa and Connor up here. Connor, who has a field hockey injury. So our next speakers, come on up. You can go ahead. And Melissa Mclaren and her daughter Connor Mclaren, who are part of the Nationwide Children's Gender Clinic. Melissa Mclaren is an advocate mom for the trans community, an author, a nurse practitioner herself, and they're here to share a little bit more about why inclusive care is so important. Thank you.
Good afternoon. My name is Melissa Mclaren, and I am the very proud mom of 14-year-old identical twins who happen to identify on different ends of the gender spectrum. We say identical twins, but fraternal genders. I am joined today by my amazing daughter, Connor. She's an incredible kid. I've seen her give her ice cream cone to a homeless man. I've seen her give extra lunch for friends going through lean times and organize a school lunchroom donation to our local food pantry. She is the kindest, bravest, and most authentic person I know, and she challenges me every day to be a better person. We've had the privilege of living in many states and working with healthcare facilities that support transgender individuals and their families. We were very relieved when we moved back to Ohio in 2015 and learned of the Thrive program at Nationwide Children's Hospital. Within a short time of moving home, we were meeting with the primary care team, and Connor was, at the time, their youngest patient in the program. I'll never forget how our nurse practitioner, Nancy Ford, introduced herself by identifying her name and pronouns and asking my daughter what name and pronouns she would like them to use. From day one, the Thrive program has validated our daughter for who she is and worked with us to navigate the right path for her and our family. I'm a mom and a nurse practitioner and a take charge kind of person. It's been no easy feat to navigate a medical landscape that is still adding to long-term research and emerging future outcomes for transgender youth. There are unique challenges to having a child at the center of so many political battles. Whose right to use the appropriate bathroom or claim the rights of her full identity or have the same opportunities as our son, her identical twin brother, are so hard fought. As a family who has chosen to be very open publicly about our journey, our decisions to support our daughter have often been questioned. She and her brother have been bullied. My husband and I have had horrible assumptions and comments made about us and to us. It has been very important to our family that we send a message to others that having a transgender child is the least exciting thing about us. Having a team to support our journey has been a key part to the health and happiness of our family, in ensuring that our biggest parenting challenges are still related to chores, homework, and electronics. The staff at the Thrive program have always made us feel that we were partners in Connor's care. They have celebrated with us, advocated for us, and have worked with us to provide Connor with the tools she needs to be a happy and healthy teenage girl. And we know that if harder times come, we have a medical team there to support us. We had a recent unexpected stay as an inpatient at Nationwide Children's due to a field hockey injury. It's a horrible place to be in when the fear you have over your child's injury and unexpected surgery is complicated by dread that someone will misgender her or be careless with their comments. I am so happy to be able to tell you that our daughter was validated for her identity from the moment we arrived to our discharge several days later. She was treated like a 14-year-old girl with an orthopedic emergency. Except sometimes I do think they made a point to be a little extra validating. Like the anesthesiologist who made a point to call her young lady several times, and the nurse who made her his chocolate milkshake, because what girl doesn't need a little extra chocolate when she's having a rough day? Thank you, Human Rights Campaign, for setting the bar high for organizations to make your healthcare equality index. We need more organizations to recognize the unique needs of this community. Thank you, Equitas, for being prepared to take up the baton when our daughter comes of age. And thank you, Nationwide Children's Hospital and the Thrive program, for recognizing how special kids like Connor are and for filling your clinic with the special staff who make our journey easier. Thank you for making the choice to stand with us in this journey and for being a role model to other organizations. Thank you.
Thank you so much. Our next speaker, who's our final speaker today, is Shannon Harden, the Columbus City Council President. He has said in his time on the council that he will be measured by how he can improve the lives of vulnerable young people in Columbus. He's also serving as the co-chair of the Columbus My Brother's Keeper initiative, which aims to bridge opportunity gaps for young people of color. It's our pleasure to have council member Shannon Harden here with us today. Come on.
What a great day in our city. To President David, welcome to Columbus, and congratulations on the new role. We're so excited to have you at HRC. To Mr. Bill Hardy, thank you so much for being a great host and having us here. To Director Hanuman, thank you so much for the work that you have done to really help tell the story of inclusiveness in healthcare and around the country. I also want to recognize our health commissioner, Commissioner Roberts. Would you stand to be recognized? Thank you. And the Columbus Public Health team for the work that you do to get us where we are. And also I saw Ms. Chris Kozad, who is the representative of the LGBTQ community for the mayor's office. And what all of the folks who took the index know is that you don't get here by happenstance. You get here by leadership and by work. And so I appreciate the leadership of Commissioner Dr. Roberts and the mayor for all they do. So on behalf of my colleagues on Columbus City Council, I am, of course, happy to be here to release the Health Equality Report. My first engagement with HRC was around the Municipal Equality Index when I worked for the former mayor. And I can remember I was the liaison to the community, and we received an 80 score out of 100. And this might say something about how I did in college, but I was pretty pleased with this. And so I remember taking the report to our then mayor and saying, we got an 80 out of 100. And the look on his face of almost anger and then disappointment in me that I would be okay with an 80. And he made me go and work with every department to get our score up to 100. And since that day, 8 years ago, the city of Columbus has kept a 100 perfect score on the Municipal Equality Index, and I am proud of that work. And so it is true too with health. The thing about this conversation is that space matters. Where you go in your most vulnerable time, it matters to know that they see you for who you are. They hear your concerns and understand you. And so when we think about these healthcare providers, Nationwide Children's Hospital, OSU Medical Center, Columbus Public Health, Ohio Health, Equitas, and the VA Ambulatory Care Center, I'm appreciative, I'm proud of Columbus, but I'm not surprised. I have a saying that if it's not for all, it's not for us. And in Columbus, it's for all of us, including our LGBTQ community. So let's just keep on keeping on Columbus and serving all of our community. Thank you and God bless.
Thank you all so much for coming here. Thanks to our speakers, and thanks to all of you for being here. Thanks to Equitas Health. We're going to close this portion now, but the speakers will stay around for questions for any of the press. Elliot Kozuch back there, can you raise your hand? They can help you with any questions, and if you want to do any interviews with anybody up here. So thank you so much.